from my organisation's point, we are trying to look at how we think about the opportunities that digital brings us. I don't think it's not the panacea that's going to solve all the workforce problems, but it certainly gives the opportunities and the tools for us to start to be a bit more productive and think about how we use digital solutions to make people's work life more efficient. I also think there's something about how we can use technology to get patients doing more of the things for themselves. We've piloted in our heart failure services an app that enables patients to self-report their condition, their various vital signs. That's remotely monitored by nurses. It means they don't have to come into hospital for routine appointments, which obviously is where we want to be in the future. So there's definitely an opportunity for technology to provide much of the solution. The challenge, candidly, we have in my organisation is that our digital architecture and infrastructure is not as well developed as we would like. So we've got to make sure some of the core systems and processes are in place to enable us to be able to capitalise on the opportunity of digital solutions. I think there's also something then about different models of workforce. So thinking about how it's the old thing, isn't it? Everyone talks about getting people to operate at the top of their license. So making sure that doctors, consultants, GPs, advanced practice nurses, therapists, and others, they're all doing the things that only they can do, and we're delegating as much as we can to other professionals and support staff, so that we are actually getting only the professionals doing the things that they can do. I think, again, there's still more work for us to do here. I think we're a little bit behind the curve, I think, in Wales in some areas, and things like advanced practice nurse consultants, therapy consultants, advanced clinical practitioners, but we're certainly in my organisation doing a lot of work on that agenda at the moment. And then also just thinking about, again, how do we make sure that we're not bringing people into hospital for things when they could be having that done in their own home or in their community setting, and so trying to reduce the burden on our hospital-based staff. So yeah, like everybody, it's a big challenge. There's never going to be enough workforce, I don't think, and it's not just a Wales problem or a UK problem. It's a global problem in terms of workforce.
Very much so, yeah.
Healthcare workforce. So I think it does drive you, though, to think about innovations and different way of doing things.